The morning sun came through the large windows of Metropolitan General Hospital. It was a busy Tuesday morning, and the waiting room was already filling up with people. Some sat quietly reading magazines. Others stared at their phones. A few talked softly with family members sitting beside them. Dr. Richard Hayes walked through the main entrance like he owned the place. In many ways, he felt like he did. He had worked at this hospital for 15 years. He was the head of the cardiac surgery department. Other doctors respected him. Nurses knew not to question his orders. Patients waited months to see him. He wore his white coat with pride. His name was stitched in blue thread on the front. Under his name it said Chief of Cardiac Surgery. He carried a tablet in one hand and an expensive coffee in the other. His shoes clicked loudly on the polished floor as he walked. Dr. Hayes stopped at the nurses' station to check his schedule. He had 3 surgeries planned for the day. He also had several consultation appointments. He liked to be busy. It made him feel important. As he reviewed his schedule, he barely noticed the people in the waiting room. To him, they were just appointments, numbers on a screen, names without faces. But there was one person in that waiting room who would change everything for Dr. Hayes. She sat in the corner by the window. She looked to be in her early 50s. Her skin was a rich brown color. Her hair was pulled back in a simple style. She wore a dark blue blazer over a white blouse. Her pants were pressed and neat. Small pearl earrings caught the light when she moved her head. She held a small black purse on her lap. Her posture was straight but relaxed. She looked like someone who was comfortable in any situation. There was something calm about her, something that made her seem different from the nervous patients around her. The woman glanced at her watch. She had arrived 30 minutes early for her appointment. She always did. Being on time was important to her. It showed respect for other people's schedules. She watched the hospital staff move around. She noticed how the nurses greeted some patients warmly and others with less enthusiasm. She saw which doctors took time to smile and which ones rushed past without looking up. She was paying attention to everything. Dr. Hayes finished checking his schedule. He turned to walk toward the cardiac unit. As he moved through the waiting room, his eyes passed over the woman by the window. He paused for just a moment. His eyebrows pulled together slightly. He seemed confused about why she might be there. Then he kept walking. He had important work to do. The woman noticed his glance. She had seen that look before. Many times, in many places. It was the look of someone making assumptions, deciding who she was without knowing anything about her. She took a slow breath and looked back out the window. 30 minutes later, the woman stood up. She walked to the reception desk. The waiting room was even more crowded now. People filled almost every seat. Some stood against the walls. The smell of coffee mixed with antiseptic cleaner. The receptionist was a young woman with blonde hair pulled into a ponytail. She wore pink scrubs with butterflies on them. She looked tired already, and it was only 9 in the morning. "Good morning," the woman said. Her voice was clear and professional. "I have an appointment at 9:30. Cardiology consultation." The receptionist looked up from her computer screen. "Name, please?" The woman gave her name quietly. The receptionist typed it into the computer. Her fingers moved quickly over the keyboard. Click, click, click. "Yes, I see you here," the receptionist said. She seemed friendly enough. "Can I see your insurance card and ID?" The woman reached into her purse. She pulled out her wallet and handed over the cards. The receptionist took them and began copying the information. That was when Dr. Hayes walked through the waiting room again. He was heading back from the cardiac unit. He had left some papers at the nurses' station. As he walked past the reception desk, he heard the receptionist processing the woman's appointment. He stopped walking. He turned around slowly. He looked at the woman standing at the desk. Then he looked at the receptionist. "Cardiology consultation?" he asked. His voice was loud enough that several people looked up. The receptionist nodded. "Yes, Dr. Hayes, 9:30 appointment." Dr. Hayes stepped closer to the desk. He looked at the woman again. His eyes moved from her face down to her shoes and back up. It was not a medical examination. It was something else. Something that made the woman stand a little straighter. "Are you sure you're in the right place?" Dr. Hayes asked. He directed the question to the woman, but his tone suggested he already knew the answer. Or thought he did. The woman turned to face him fully. Her expression did not change. "Yes," she said simply. "I'm in the right place." Dr. Hayes crossed his arms. This is a specialized cardiac unit. We handle complex cases, very expensive procedures. Are you certain your insurance covers this level of care? The receptionist looked uncomfortable. She glanced between Dr. Hayes and the woman. She opened her mouth like she wanted to say something but then closed it again. My insurance is fine, the woman said. Her voice remained calm, steady. Is there a problem? Dr. Hayes made a sound that was almost a laugh. I'm just trying to save you time, and frankly save the hospital's resources. There's a community clinic about 5 miles from here. They handle more basic care. It might be more appropriate for your needs, more affordable. Several people in the waiting room were watching now. They pretended to look at their phones or magazines, but their attention was on the conversation at the desk. The woman did not look away from Dr. Hayes. I have a referral from my primary physician. I have an appointment. I would like to keep that appointment. The receptionist held up the insurance card. Dr. Hayes, her insurance is actually very comprehensive. It covers all our services here. Dr. Hayes took the card from the receptionist's hand. He looked at it closely. Too closely, like he was searching for something wrong with it. After a long moment, he handed it back. Insurance cards can be misleading, he said. He was still talking loudly, making sure others could hear. Coverage doesn't always mean approval. Many procedures require pre-authorization. Do you understand what that means? The woman's jaw tightened slightly. It was the first crack in her calm exterior, but her voice remained level. I understand medical terminology quite well, thank you. Do you? Dr. Hayes raised his eyebrows. Because many people come in here expecting treatment they can't actually afford. They think because they have an appointment, everything is taken care of. Then they're shocked when they get the bill. We're talking about thousands of dollars, tens of thousands sometimes. The woman took a slow breath. I appreciate your concern about costs. However, I have discussed everything with my primary care physician. I'm prepared for this consultation. Dr. Hayes shook his head. He turned to the receptionist. How many appointments do we have today? 17. The receptionist answered quietly. 17. Dr. Hayes repeated, looking back at the woman. 17 people who genuinely need specialized cardiac care. We can't waste time and resources on cases that should be handled elsewhere. The woman's hands gripped her purse a little tighter. The small movement was the only sign of her growing frustration. I was referred here by a cardiologist. This is not a waste of time. But Dr. Hayes was not finished. He had an audience now and he seemed to be enjoying it. His voice grew louder, more confident, more certain that he was doing the right thing. Look, he said, spreading his hands like he was being reasonable. I'm trying to help you understand how things work here. This is a teaching hospital. We handle complex cases. We do research. We perform procedures that other hospitals can't do. We need to make sure our resources go to the patients who truly need them. The woman remained silent for a moment. She looked at Dr. Hayes carefully, like she was studying him, learning something important about him. Finally, she spoke. May we discuss this in private? Dr. Hayes laughed. A real laugh this time. Everything can be discussed right here. There's nothing private about insurance and appointments. If you have proper coverage and a legitimate need, there's nothing to hide. Right? The woman nodded slowly. You're correct. There's nothing to hide. But Dr. Hayes had already turned away. He was done with the conversation. Or so he thought. Dr. Hayes did not walk away. Instead, he moved closer to the reception desk. He seemed to be getting more confident with each passing moment. The waiting room had gone quiet. People were no longer pretending to look at their phones. They were watching openly now. You know what I see every single day? Dr. Hayes said. His voice carried across the room. I see people who come in here with unrealistic expectations. They think healthcare is free. They think they can just show up and demand the best treatment without considering the cost to the system. The woman stood perfectly still. Her face showed no emotion, but inside something was stirring. Years of training helped her maintain her composure. Years of facing moments just like this one. I have insurance, she said again. Her voice was quiet but firm. I have a referral. I have an appointment. What exactly is the issue? Dr. Hayes leaned against the reception desk. He was getting comfortable now, settling in. The issue is accountability, personal responsibility, making good choices. These are things that many people don't understand. They make poor decisions their whole lives, and then they expect the healthcare system to fix everything. A few people in the waiting room shifted uncomfortably. An elderly white couple exchanged glances. A young man with his arm in a sling stared at his shoes. A mother with two small children pulled them closer. The receptionist typed something into her computer. Her hands were shaking slightly. "Dr. Hayes," she said softly. "Should I just check her in? Her appointment time is in 5 minutes." "No," Dr. Hayes said sharply. "Not yet. I want to make sure everything is in order. We have protocols for a reason." He turned back to the woman. "Where do you live? What neighborhood?" The woman's eyebrows raised slightly. "I don't see how that's relevant to my medical care." "It's relevant because different areas have different coverage options, different programs. I'm trying to help you find the right fit." "I already have coverage," the woman repeated, as the receptionist confirmed. Dr. Hayes waved his hand dismissively. "Coverage on paper doesn't always mean coverage in practice. Tell me, have you ever had cardiac issues before? Heart disease runs in certain populations. Certain communities have higher rates due to lifestyle factors. Diet, exercise, stress from poor life choices." Several people in the waiting room looked shocked. One woman whispered to her husband. Another man shook his head in disbelief. But still no one spoke up. No one challenged Dr. Hayes. The woman took a deep breath. "My medical history is between me and my doctor. I don't need to discuss it in a public waiting room." "But that's exactly my point," Dr. Hayes said, his voice rising. "If you had a real emergency, you would be in the ER, not sitting here for a consultation. This tells me your situation isn't urgent, which means you could easily go to a community clinic. They offer perfectly adequate care for non-emergency situations. Why burden this facility?" A young nurse walked past carrying a stack of files. She slowed down when she heard Dr. Hayes talking. She looked at the woman, then at Dr. Hayes, then quickly walked away. She did not want to get involved. The woman remained calm. "I would like to speak with the hospital administrator." Dr. Hayes laughed. "The administrators are busy running a hospital. They don't have time to handle every patient who doesn't like being asked reasonable questions. Look, I'm going to be honest with you. Brutally honest. Because I think you need to hear this." He stepped closer to her, close enough that it felt intimidating. The woman did not step back. "I've been doing this for 15 years, Dr. Hayes said. I've seen every excuse, every sob story, every attempt to game the system. People come in here thinking they deserve the best care without earning it, without paying for it properly. They want to cut in line ahead of people who have worked hard, made good choices, and planned for their healthcare needs. I have not asked to cut any line," the woman said. "I made an appointment weeks ago. I arrived early. I have followed every rule." "Rules," Dr. Hayes scoffed. "You know what else is a rule? Efficiency. Using resources wisely, not wasting the time of highly trained specialists on cases that don't require our expertise. Do you know how much my time costs? How much training I have? I didn't go through 4 years of medical school and 6 years of residency to deal with people who should be seeing a general practitioner." The receptionist tried one more time. "Dr. Hayes, maybe we should—" "No," Dr. Hayes cut her off. "This is important. This is about the integrity of our healthcare system. If we just let everyone come in demanding top-tier care without proper vetting, the whole system collapses. Someone has to make the hard decisions. Someone has to ask the difficult questions." 2 medical residents had stopped nearby. They were young doctors still in training. They stood with tablets in their hands, pretending to review patient charts. But they were listening to every word, learning from Dr. Hayes. Watching how he handled things, Dr. Hayes noticed them. He turned slightly so they could hear him better. "Gentlemen," he said to the residents, "come here. This is a teaching moment." The 2 young doctors exchanged uncertain glances. Slowly, they walked over. They looked uncomfortable but did not refuse. Dr. Hayes was their superior. They had to listen to him. "This is a perfect example," Dr. Hayes said, gesturing toward the woman, "of what we call healthcare entitlement. Notice the expectation that the system will simply accommodate any request without question. Notice the resistance to reasonable inquiry about appropriateness of care. This is what you'll face in your careers. You need to learn how to manage it professionally." One of the residents opened his mouth, then closed it. The other stared at his shoes. The woman looked at the residents. Her eyes were sad, not angry, just sad. Like she was disappointed that they were witnessing this, learning this, being taught that this was acceptable behavior. "What you're teaching them is wrong," the woman said quietly. But her words cut through the air like a knife. This has nothing to do with appropriate care or resource management. This is about bias. This is about assumptions based on how someone looks. Dr. Hayes' face turned red. Now wait just a minute. I resent that accusation. I treat all patients equally. I ask the same questions of everyone. If you're trying to play some kind of race card here, I haven't mentioned race, the woman interrupted. You're the one making assumptions about my neighborhood, my lifestyle choices, my ability to pay, my understanding of medical terminology. You're the one who decided I don't belong here the moment you saw me. That's ridiculous, Dr. Hayes said, but his voice was too loud, too defensive. I'm a doctor. I make medical decisions based on medical criteria, nothing else. The fact that you're trying to twist this into something it's not shows exactly the kind of manipulative behavior I'm talking about. A security guard had wandered over. He stood at a distance, watching. His hand rested on his radio. He looked ready to call for backup if things escalated. The woman saw him. She gave him a small nod, a message that she was okay, that she was not going to cause a scene. The security guard relaxed slightly but did not leave. I'm not being manipulative, the woman said. I'm asking for basic respect, for the same treatment you would give to anyone else who walked through that door with an appointment. Dr. Hayes shook his head. You're getting the same treatment. You just don't like being held accountable. Let me tell you something else. Something else you need to understand. He was on a roll now. His voice filled the waiting room. Several more staff members had stopped to watch. A janitor paused, mopping the floor. 2 volunteers at the information desk stared openly. Healthcare is expensive, Dr. Hayes continued. Someone has to pay for it. When people abuse the system, when they use resources they haven't properly planned for, everyone else pays. Hardworking taxpayers. People with good insurance who made responsible choices. They foot the bill for people who think the world owes them something. The woman's hands were gripping her purse so tightly now that her knuckles showed through her brown skin, but still her voice remained calm. Still she did not yell, did not curse, did not give Dr. Hayes any reason to call security on her. I am a taxpayer, she said. I have worked every day of my adult life. I have excellent insurance through my employer. I have made every responsible choice you claim people like me don't make. And yet here you are assuming the worst about me based on nothing but your own prejudice. Prejudice. Dr. Hayes repeated the word like it tasted bad. That's a serious accusation. A false accusation. And I don't appreciate it. I'm trying to run an efficient department. I'm trying to protect hospital resources. If you can't understand that, if you can't accept that sometimes the answer is no, then maybe you're not mature enough to be a patient here. The woman stared at him for a long moment. People in the waiting room held their breath. The receptionist had stopped typing. The residents stood frozen. Everyone was waiting to see what would happen next. Then the woman did something unexpected. She smiled. Not a big smile. Just a small one. Barely there. But it was there. May I make a phone call? She asked. Dr. Hayes blinked. He had not expected that response. What? A phone call, the woman repeated. I would like to make a phone call. Is that allowed? Or do I need your permission for that too? The woman watched Dr. Morrison approach, but she did not move. She did not call out to him. She simply waited, the same way she had been waiting all morning, with patience that came from years of practice, years of holding her composure when everything inside her wanted to react. Dr. Hayes noticed his superior approaching. He straightened up immediately. His whole posture changed. He went from aggressive to professional in a matter of seconds. He smoothed down his white coat. He adjusted the stethoscope around his neck. Dr. Morrison, Dr. Hayes said with a smile. Good morning. I wasn't expecting to see you on this floor today. Dr. Morrison barely looked at him. His eyes were fixed on the woman. His face was pale. When he spoke, his voice was tight with stress. Dr. Hayes, I need to speak with you immediately. In the conference room, Dr. Hayes looked confused. Of course. But I'm just finishing up here with, now, Dr. Morrison said. It was not a request. It was an order. The woman spoke for the first time since making her phone call. Her voice was calm, almost gentle. It's all right. We can all talk together. I think that would be best. Dr. Morrison nodded quickly, too quickly. Yes, of course. Whatever you prefer. He turned to the receptionist. Please clear conference room B immediately. Hold all calls. The receptionist's eyes went wide. She had never heard Dr. Morrison sound so stressed. She picked up the phone and made the call. Her hands were shaking as she dialed. Dr. Hayes was starting to look worried now. But he still did not understand. Not really. He thought maybe there was a problem with the woman's insurance after all. Maybe he had been right to question her. Maybe Dr. Morrison was going to back him up. "Should I bring the residents?" Dr. Hayes asked. "Since this is a teaching moment?" "No," Dr. Morrison said sharply. "Just you, now." The two young residents looked relieved. They quickly walked away, their tablets clutched to their chests. They did not want any part of whatever was about to happen. They had seen enough, heard enough. They would talk about this day for years to come. But right now they just wanted to leave. The woman picked up her purse. She followed Dr. Morrison and Dr. Hayes down a long hallway. Her heels clicked softly on the tile floor. She looked straight ahead. Her face showed nothing. No anger, no satisfaction, no emotion at all. The waiting room buzzed with whispers as soon as they left. Everyone had an opinion. Everyone had something to say. "Did you see that?" one woman whispered to her husband. "That doctor was way out of line," a young man said to no one in particular. "I got it on video," another voice said. A teenage girl held up her phone. "The whole thing. Should I post it?" The security guard stepped closer to her. "Miss, I need you to delete that right now." "Why?" the girl asked. "This is a public place. I can record whatever I want." The security guard looked uncomfortable. "Hospital policy, patient privacy." "But she's not a patient," the girl argued. "That doctor wouldn't even let her check in." The security guard did not have an answer for that. He walked away, speaking quietly into his radio. This was above his pay grade, way above. Down the hall, Dr. Morrison opened the door to conference room B. It was a small room with a long table and 8 chairs. Windows looked out over the hospital parking lot. A whiteboard on one wall still had notes from yesterday's staff meeting. Dr. Morrison gestured for the woman to sit. She chose a chair in the middle of the table. Not at the head. Not in the corner. Right in the middle. Dr. Hayes sat across from her. Dr. Morrison stood. He could not seem to sit down. He was too nervous. "Dr. Richardson," Dr. Morrison began. His voice was apologetic, almost pleading. "I cannot tell you how sorry—" Dr. Hayes's head snapped up. "Richardson," he repeated. Something in his mind was clicking, trying to make connections. That name sounded familiar. Where had he heard it before? The woman looked at Dr. Hayes for the first time since they entered the room. Her expression was neutral. "Yes, Dr. Diane Richardson. I believe we should properly introduce ourselves since we skipped that step earlier." Dr. Hayes's face went from confused to worried to terrified in about 3 seconds. The color drained from his cheeks. His mouth opened, but no sound came out. Dr. Morrison continued, his words tumbling out fast. "Dr. Richardson is the newly appointed State Health Commissioner. She formerly served as an advisor to the Surgeon General. She has 40 years of experience in healthcare administration and cardiac medicine. She completed her residency at Johns Hopkins. She has published over 60 research papers. She has received numerous awards for her work in healthcare policy and patient advocacy." Dr. Hayes made a small choking sound. His hands gripped the edge of the table. "And," Dr. Morrison continued, looking like he might be sick, "she is the incoming chair of this hospital's board of directors. She officially assumes that position next Monday. Today she was here for a routine personal cardiology follow-up appointment. An appointment that has been scheduled for 3 weeks." The room went silent. The only sound was the air conditioning humming through the vents. Somewhere far away, a phone rang. Life went on in the hospital. But in this room, time seemed to stop. Dr. Richardson spoke. Her voice was still calm, still professional, but there was steel underneath now. "I wanted to experience the hospital as a regular patient. I wanted to see how our systems work from the other side. I wanted to understand what patients feel when they walk through those doors." Dr. Hayes tried to speak. I didn't. How was I supposed to? No. Dr. Richardson finished for him. "You weren't supposed to know. That was the entire point. I didn't announce my visit. I didn't request special treatment. I simply made an appointment like any other patient. I arrived early. I dressed professionally but casually. I wanted to be treated like everyone else. And instead," Dr. Morrison said, his voice full of anger and embarrassment. "You were subjected to the most unprofessional, discriminatory treatment I have ever witnessed in my 23 years at this hospital." Dr. Hayes was shaking his head, back and forth, back and forth. I was trying to protect hospital resources. I ask everyone those questions. I always check to make sure." "No," Dr. Richardson interrupted. "You don't? I have spent the last hour in your waiting room. I watched you interact with 7 other patients. White patients. You greeted them warmly. You asked about their families. You joked with them. You never once questioned their insurance. You never once suggested they go to a community clinic. You never once gave them a lecture about personal responsibility." Dr. Hayes opened his mouth to argue, but Dr. Richardson held up her hand. "I watched you greet Mrs. Patterson," she continued, the elderly woman in the floral dress. "You asked about her grandchildren. You told her you would take good care of her. You called her dear and helped her with her paperwork. I watched you talk to Mr. Chen. You discussed his golf game. You congratulated him on his retirement. You personally walked him back to the examination room. I watched you interact with that young white woman with the baby. You told her she was doing a great job as a new mother. You reassured her that her concerns were valid and important." Dr. Richardson's voice never rose, never got angry. She was simply stating facts. But each fact landed like a punch. "But with me," she said, "you saw a middle-aged black woman, and immediately, without knowing anything about me, you decided I didn't belong. You decided I couldn't afford proper care. You decided I was trying to abuse the system. You decided I needed to be educated about personal responsibility. You decided all of this in the first 5 seconds of seeing me." Dr. Hayes was crying now, actual tears running down his face. "I'm sorry," he whispered. "I'm so sorry. I didn't mean. I never intended." "Didn't mean what?" Dr. Richardson asked. "Didn't mean to reveal your bias? Didn't mean to treat a patient with such disrespect? Didn't mean to violate every principle of medical ethics? Didn't mean to do it in front of an audience?" She leaned forward slightly. "Or didn't mean to get caught?" Dr. Morrison sank into a chair. He put his head in his hands. "This is a disaster." "An absolute disaster." "It is," Dr. Richardson agreed, "but not for the reason you think." Both men looked at her. "The disaster isn't that this happened to me," she explained. "I'm fine. I have the position and the power to handle this. The disaster is that this happens to other patients. Patients who don't have my credentials. Patients who don't have my confidence. Patients who don't know their rights. Patients who are intimidated by people in white coats." She looked directly at Dr. Hayes. "How many other people have you treated this way? How many patients have you turned away based on nothing but your assumptions? How many people needed care and left because you made them feel small, feel unworthy, feel like they didn't belong?" Dr. Hayes could not answer. He just shook his head and cried. "I want to see the complaint records for Dr. Hayes," Dr. Richardson said to Dr. Morrison. "Patient complaints, staff complaints, everything. I want to know if this is an isolated incident or a pattern of behavior." Dr. Morrison nodded. "I'll have them pulled immediately. I also want to see the security footage from the waiting room. All cameras. From the moment I walked in until now. Of course, anything you need." Dr. Richardson stood up. She smoothed her blazer. "I'm going to review everything carefully. I'm going to speak with other patients and staff members. I'm going to conduct a thorough investigation before I take my position on the board next week." "What?" Dr. Hayes's voice was hoarse. "What happens to me?" Dr. Richardson looked at him for a long moment. "That depends on what the investigation reveals. But I can tell you this much. What happened today violated multiple hospital policies. It violated professional ethics guidelines. It created a hostile environment. It brought shame to this institution. And it was recorded by several people on their phones." Dr. Hayes's face went even paler. "Recorded?" "At least 3 people that I saw," Dr. Richardson said. "Maybe more. One of them was a teenage girl who wanted to post it online. The security guard tried to make her delete it. Whether she did or not, I don't know. But I do know that in today's world, these things have a way of spreading quickly." Dr. Morrison groaned. "The hospital's reputation, yes," Dr. Richardson said. "That's something we need to discuss. How do we handle this publicly? How do we address the damage? But more importantly, how do we make sure it never happens again? To anyone?" She picked up her purse. "I'm going to go home now. I'll reschedule my cardiology appointment for a time when I can actually receive medical care instead of judgment. Dr. Morrison, I'll expect those files on my desk by tomorrow morning. All of them. Don't leave anything out. Yes, Dr. Richardson, absolutely. She walked to the door. Then she paused and turned back. Dr. Hayes, I want you to think about something. Think about all the patients you've met over the years. Think about the ones who remind you of yourself, your family, your friends. Think about how you treat them. With kindness, with respect, with the benefit of the doubt. Now think about the patients who don't remind you of yourself, the ones who look different, come from different places, have different backgrounds. Ask yourself honestly, do you treat them the same way? And if not, why not? What does that say about you as a doctor? As a person? Dr. Hayes could not look at her. He stared at the table, at his hands, at anything except her face. A good doctor sees patients, Dr. Richardson said, not stereotypes, not assumptions, not their own biases reflected back at them. Just patients, human beings who need help. That's all anyone should see when someone walks through those doors. Just another human being who needs help. She opened the door and walked out. Her footsteps echoed down the hallway, getting quieter and quieter until they could not be heard at all. Dr. Morrison and Dr. Hayes sat in silence for a long time. Neither one knew what to say. Neither one knew what would happen next. But both of them knew that everything had changed. For them, for the hospital, for everyone. And it had all happened because of one doctor's inability to see past the color of someone's skin. Dr. Richardson walked out of the hospital into the bright morning sunshine. She stood for a moment on the front steps, taking deep breaths. Her hands were steady now. The tight grip on her purse had relaxed. But inside, emotions swirled like a storm. She was not angry. She had been angry before. Many times. In medical school, when a professor assumed she was a nurse. In her residency, when patients asked for a real doctor after she introduced herself. In her years of practice, when colleagues dismissed her ideas until a male doctor repeated them. She had learned to channel that anger into action, into change. But today felt different. Today she felt tired. Bone-deep tired. Not from lack of sleep, but from decades of having to prove herself, over and over again, to people who had already decided who she was before she opened her mouth. She walked to her car. A modest sedan, not expensive but well-maintained. She got in and sat behind the wheel. For the first time all morning, she let her professional mask slip. Her shoulders sagged. She closed her eyes and took several long breaths. Her phone rang. She looked at the screen. It was her husband, James. She answered. "Hi, honey," she said. Her voice sounded tired now. The composure had cost her more than anyone knew. "How did it go?" James asked. "Did you get to see the hospital? What did you think?" Dr. Richardson let out a long breath. "It was educational." "That doesn't sound good." "What happened?" "I'll tell you when I get home. I'm leaving now. Are you okay?" "You sound off." "I'm okay. Just tired." "I'll see you soon." She ended the call and started the car. As she drove out of the parking lot, she looked back at the hospital in her rearview mirror. It was a beautiful building. Modern, well-equipped. It served thousands of patients every year. But beauty meant nothing if the people inside it were broken. Back inside the hospital, the waiting room was still buzzing with conversation. Word had spread quickly. Nurses whispered at their stations. Doctors gathered in small groups. Everyone had heard something. The details got bigger and more dramatic with each retelling. "I heard she's a senator," one nurse said. "No, she's the head of the entire state health department," another corrected. "Someone said she's on the board of directors." "I heard Dr. Hayes is getting fired today." "I heard he already left, just packed up his office and walked out." The receptionist who had witnessed everything sat at her desk. She had not moved since Dr. Richardson left. Her hands were still shaking. She had worked at this hospital for 6 years. She had seen Dr. Hayes treat patients before. Now that she thought about it, she realized she had seen patterns, things she had noticed but never really paid attention to. How he was friendlier with some patients than others. How his tone changed depending on who stood in front of him. How he made certain assumptions. The receptionist felt sick. She should have said something. She should have spoken up. But she had been afraid. Afraid of losing her job. Afraid of making waves. Now she wondered what her silence had cost. How many patients had been hurt? How many people had left without getting the care they needed? A senior nurse named Patricia walked over to the reception desk. She was in her 60s, had worked at the hospital for 30 years. She had seen everything, done everything. She was respected by everyone on staff. "Are you okay?" Patricia asked the receptionist gently. The receptionist shook her head. "I should have said something. I should have stopped him," Patricia sighed. "We all should have." I walked past. I heard what was happening, and I kept walking. Because it was easier. Because I told myself it wasn't my business. Because I was a coward. "What's going to happen now?" "I don't know," Patricia said. "But things are going to change. They have to." In his office, Dr. Morrison was on the phone. He had made 6 calls in the last 20 minutes. To the hospital's legal team, to human resources, to the board president, to public relations. Everyone needed to know what had happened. Everyone needed to prepare. "Are we sure about who she is?" the board president asked over the phone. "Can we verify this?" "I've verified it," Dr. Morrison said. He sounded exhausted. I looked up her credentials myself. Called the state health department. "It's her. Everything she said is true. She starts as board chair on Monday. And you're telling me she was treated like this? In our hospital? In front of witnesses?" "Multiple witnesses. Some of them recorded it on their phones." The board president swore. Actually swore. Dr. Morrison had never heard him use that kind of language before. "This is a nightmare," the board president said. "Do you know what kind of damage this could do? To our reputation? To our funding?" The state health commissioner, the incoming board chair. "I know," Dr. Morrison said quietly. "What do you know about Dr. Hayes? Has he done this before?" "I'm pulling his records now. Patient complaints, staff reports, everything. We should have the full picture by end of day. And in the meantime, I've suspended him pending investigation." "Full suspension. No patient contact. Good, keep me updated. Every detail." "I need to know everything." Dr. Morrison hung up the phone. He sat back in his chair and rubbed his temples. A headache was forming behind his eyes. He had been chief of medicine for 7 years. He loved this job. He loved this hospital. And now he was watching it fall apart because one doctor could not see past his own prejudice. But was it just one doctor? That was the question that bothered him most. How many other staff members had biases they did not recognize? How many patients had been treated unfairly? How deep did this problem go? Down the hall, Dr. Hayes sat in his office with the door closed. The lights were off. He sat in the dark, staring at nothing. His career was over. He knew that. Everything he had worked for, everything he had built, was crumbling around him. But worse than losing his career was the realization that he deserved to lose it. Dr. Richardson's words kept echoing in his mind. "How many other people have you treated this way?" He tried to tell himself that he was not racist, that he treated everyone fairly, but as he sat in the dark, memories started surfacing, moments he had forgotten, or more honestly, moments he had ignored. The Hispanic man he had assumed did not speak English. The Asian woman he had asked where she was really from. The black teenager he had accused of drug seeking without any evidence. The Muslim woman whose symptoms he had dismissed as anxiety. How many? How many people had he hurt with his assumptions, his unconscious biases, his unexamined prejudices? He had gone to medical school to help people. That was his calling, his purpose. Somewhere along the way he had lost sight of that. He had started seeing categories instead of people, making judgments instead of diagnoses, protecting his ego instead of serving his patients. There was a knock on his door. He did not answer. The knock came again, louder this time. "Dr. Hayes?" It was Patricia, the senior nurse. "I need to speak with you." He did not want to talk to anyone. But Patricia was not someone you ignored. He stood up slowly and opened the door. Patricia looked at him with an expression he could not quite read. Not angry, not sympathetic, something in between. "You need to go home," she said. "Dr. Morrison wants you off hospital grounds immediately. You're on administrative leave pending investigation." Dr. Hayes nodded. He had expected this. "How long?" "I don't know. Could be days. Could be weeks. Could be permanent." He nodded again. He started gathering his things. His medical bag, his stethoscope, personal photos from his desk. Patricia watched him pack. She did not help. She did not speak. She just watched. "I'm not a bad person," Dr. Hayes said suddenly. He needed someone to know that. To believe that. I didn't mean to hurt anyone. Patricia was quiet for a long moment. Then she said, intention doesn't matter as much as impact. You may not have meant to hurt anyone, but you did. You hurt that woman today, and probably dozens of others over the years. Good intentions don't erase that harm. What should I have done differently? Patricia looked surprised by the question, like she could not believe he did not know. You should have treated her like a person, like a patient. You should have done your job without letting your assumptions take over. It's really that simple. Dr. Hayes finished packing his bag. He looked around his office one last time. He had spent so many hours here, so many years. He thought he had been building something important. Now it all seemed empty. He walked out of his office. Patricia followed him to make sure he left the building. As he walked through the hallways, he could feel people staring, whispering. Everyone knew. Everyone had heard. He reached the parking lot and got in his car. He sat there for a moment, hands on the steering wheel, trying to figure out how his day had gone so wrong. This morning he had been a respected surgeon. Now he was suspended, possibly about to be fired, possibly about to lose his medical license. All because he could not see a patient as just a patient. All because he let his biases control his actions. All because he thought he knew better than everyone else. Thought he was protecting the hospital when really he was just protecting his own prejudices. He started his car and drove home. He did not know what he would tell his wife, his children. How do you explain that you might lose everything because of your own prejudice? How do you admit that you were wrong in such a fundamental way? Back at the hospital, the two medical residents who had witnessed the incident sat in the break room. They were supposed to be studying, but neither could focus. They kept replaying the scene in their minds. Should we have said something? One of them asked. His name was David. He was in his second year of residency. The other resident, Eric, shook his head. What could we have said? He's our attending. We can't just contradict him in front of patients. But what he was doing was wrong. We both knew it was wrong. Knowing it and being able to stop it are two different things. David was quiet for a moment. Then he said, "Is that the kind of doctor I want to be? The kind who knows something is wrong but doesn't say anything? What's the point of learning medicine if we don't also learn to stand up for what's right?" Eric did not have an answer for that. They sat in silence, both of them thinking about the same thing. They were learning more than medicine in this residency. They were learning about character, about courage, about the kind of doctors they wanted to become. And they were learning that sometimes the hardest part of being a doctor had nothing to do with science or procedures. Sometimes it was about having the strength to speak up when everyone else stayed silent. The hospital day continued. Patients were seen, surgeries were performed, babies were born, lives were saved. The work went on because it had to, because people needed care, because that was the mission. But underneath the normal routine, something had shifted. People were paying attention now, looking at things differently, asking questions they should have asked long ago, noticing patterns they had been ignoring. Change was coming, not because anyone wanted it, but because it was necessary, because Dr. Diane Richardson had walked through those doors and exposed a truth that everyone had been trying to ignore. And once truth is exposed, you cannot put it back in the box. You cannot pretend you did not see it. You can only decide what you are going to do about it. That was the question facing Metropolitan General Hospital now. What were they going to do about it? How were they going to change? How were they going to make sure this never happened again? The answers would come. But not today. Today was just for realizing how deep the problems went. Tomorrow would be for figuring out solutions. Dr. Richardson arrived home to find her husband James waiting in the kitchen. He had made tea. 2 cups sat on the counter, steam rising gently. He knew her well enough to understand that when she said she was tired, it meant something had gone seriously wrong. She set her purse down and accepted the cup of tea. They sat at the kitchen table together. The morning sun came through the window, making patterns on the floor. Everything looked peaceful, normal, but she felt anything but peaceful. "Tell me," James said simply. So she did. She told him everything. From the moment Dr. Hayes first questioned her in the waiting room, to her final words in the conference room, James listened without interrupting. His jaw got tighter as the story went on. His hands gripped his own teacup harder. When she finished, he was quiet for a long moment. Then he said, That hospital has no idea what they just unleashed. Dr. Richardson smiled slightly. No, they don't. What are you going to do? I'm going to fix it. The whole system. Not just punish one doctor, though that will happen, but I'm going to use this as an opportunity to examine everything. How patients are treated, how staff are trained, how biases are addressed or ignored. Everything. James reached across the table and took her hand. Are you okay, though? Really okay? I know you're in fix-it mode, but that had to hurt. Having someone treat you that way. Dr. Richardson squeezed his hand. It hurt more thinking about all the people who get treated that way and don't have the power to do anything about it. I can handle it. I have the credentials, the position, the confidence. But what about the single mother working 2 jobs? What about the elderly man who barely speaks English? What about the young person who is already scared of doctors? They get treated like that and they just leave. They don't get the care they need. That's what hurts, James nodded. He understood. He had been married to her for 28 years. He knew that her passion for healthcare was not about power or prestige. It was about making sure everyone got treated with dignity. Everyone got the care they deserved. When do you officially start as board chair? He asked. Monday. But I'm not waiting until Monday to start working. I have phone calls to make, reports to review, plans to develop. She stood up and walked to her home office. James watched her go. He knew that look. That determination. That focus. Metropolitan General Hospital was about to experience a transformation. Whether they were ready for it or not. Dr. Richardson spent the afternoon on the phone. She called colleagues in other hospitals. People who had experience with bias training. Experts in healthcare equity. Patient advocacy groups. She was building a team. Gathering resources. Preparing for the work ahead. At the hospital, Dr. Morrison was doing his own work. He had pulled all of Dr. Hayes's files, patient complaints going back 5 years, staff reports, performance reviews. Everything was spread across his desk now, and the pattern was clear, undeniable, horrifying. There were 17 formal patient complaints about Dr. Hayes. 17. Most of them from patients of color. Complaints about rudeness, dismissive behavior, assumptions about their ability to pay, questions about whether they really needed certain treatments, suggestions that they go to other facilities. But the complaints had never been taken seriously. They had been filed away, explained away, dismissed as misunderstandings or personality conflicts. No real investigation had ever been done. No discipline had ever been given. Dr. Morrison felt sick reading through them. How had this happened? How had he let it happen? He was chief of medicine. It was his job to know what was happening in his hospital. His job to protect patients. And he had failed. There was a knock on his door. He looked up to see Patricia standing there. "Come in," he said. Patricia closed the door behind her. She sat down across from him. "I heard you're reviewing Dr. Hayes's files." "I am. And it's worse than I thought." "I know," Patricia said quietly. "I've known for years." Dr. Morrison looked at her sharply. "You knew? And you didn't say anything?" Patricia met his gaze steadily. "I tried. 3 times. I filed reports about concerning behavior, about comments I heard, about patients who left upset. Each time I was told I was being too sensitive, that Dr. Hayes was just direct, that he didn't mean anything by it. After a while, I stopped reporting. Why didn't you come directly to me? Would you have listened? Really listened? Or would you have defended him like everyone else did? He was your star surgeon. He brought in money, prestige, publications. Would you have risked that based on the concerns of a nurse? Dr. Morrison wanted to say yes. He wanted to believe he would have listened, would have investigated, would have done something. But honestly, he did not know. Patricia was right about one thing. Dr. Hayes had been valuable to the hospital, and sometimes valuable people get away with things they should not. I'm listening now, Dr. Morrison said finally. Tell me everything. Every incident you remember. Every concern you have. I need to know the truth. All of it. Patricia took a deep breath. Then she started talking. She talked for over an hour. About things she had witnessed. Things she had heard. Patterns of behavior that had been ignored for too long. By the time she finished, Dr. Morrison had filled several pages with notes. Thank you, he said when she was done. I know that wasn't easy, but I needed to hear it. What happens now? Patricia asked. Now I compile everything. Give it to Dr. Richardson. Let her see the full scope of the problem, and then we figure out how to fix it. Not just with Dr. Hayes, with the whole culture that let this happen. Patricia stood to leave. At the door, she turned back. Dr. Morrison? For what it's worth, I think this might be good for the hospital. Painful but good. Sometimes you need to break something completely before you can rebuild it properly. After she left, Dr. Morrison continued working. He pulled security footage from the waiting room. He watched the entire incident from multiple angles. It was even worse seeing it on video. The condescension in Dr. Hayes' body language. The discomfort of the other patients. The professionalism of Dr. Richardson in the face of such disrespect. He also noticed something else. The number of staff members who walked past. Who heard what was happening? Who did nothing? The problem was not just Dr. Hayes. It was the culture that allowed his behavior. The silence of bystanders. The assumption that speaking up would cause more problems than staying quiet. He made a note to himself. Bias training would not be enough. They needed to create a culture where people felt safe speaking up, where reporting concerns was encouraged, not punished, where patient dignity was more important than protecting staff egos. His phone rang. It was the hospital's legal counsel. "We have a problem," the lawyer said. 3 videos of the incident have been posted online. They're spreading fast. Local news has already picked it up. They're asking for comment. Dr. Morrison closed his eyes. What are they saying? Everything. That a doctor harassed a patient. That the patient turned out to be the incoming board chair. That the hospital has a racism problem. It's everywhere. Twitter, Facebook, TikTok, the videos have hundreds of thousands of views already. What do? We need to get ahead of this. Make a statement. Show that we're taking it seriously. Otherwise, the narrative gets away from us completely. What kind of statement? That's above my pay grade. You need to talk to Dr. Richardson. She's the one who experienced it, and she's about to be your boss. Nothing gets said publicly without her approval. Dr. Morrison hung up and immediately called Dr. Richardson. She answered on the second ring. I was expecting your call, she said. I've seen the videos. I'm sorry. I don't know how to contain this. You don't contain it, Dr. Richardson said firmly. You address it head on. With honesty. With accountability. With a real plan for change. The board is panicking. They're worried about funding. About reputation. About lawsuits. Let them panic. Sometimes panic leads to action. Here's what's going to happen. Tomorrow morning I'm coming to the hospital. We're calling an emergency board meeting. We're going to review everything. Every complaint. Every report. Every piece of evidence, and then we're going to make a plan. And Dr. Hayes? His employment is terminated effective immediately. His behavior violated multiple policies. He created a hostile environment. He brought disrepute to the institution. But more importantly, he hurt patients. That alone is enough. He'll probably sue. Let him. We have documentation. We have witnesses. We have video evidence. He doesn't have a case. But even if he did, doing the right thing is worth the risk. Dr. Morrison felt some of his stress ease. Having clear direction helped. Having someone willing to make hard decisions helped. What about a public statement? Draft something. Focus on 3 things. Acknowledgement of what happened. Apology to me and any other patients affected. Commitment to real measurable change. Send it to me before releasing it. I'll review and approve. Understood. One more thing, Dr. Morrison, this is not just about punishing one doctor. This is about examining the entire system. Are you prepared for that? Are you prepared for what we might find? For the changes we'll need to make? Dr. Morrison looked at the files spread across his desk. At the complaints that had been ignored. At the pattern of behavior that had been allowed. At his own failure to see what was happening in his own hospital. Yes, he said, I'm prepared. This has been a wake-up call. For me personally, for the hospital, we need to do better. We will do better. Good, I'll see you tomorrow at 8. And Dr. Morrison, get some rest tonight. Tomorrow is going to be a long day. She hung up. Dr. Morrison sat back in his chair. He looked out his window at the hospital grounds. At the building he had served for so many years. At the institution he loved, it was going to change. Everything was going to change. And he was ready for it. That evening, Dr. Hayes sat in his living room. His wife Margaret sat beside him. She had read the news stories, seen the videos, heard the accusations. She did not know what to say. Did not know how to help. I didn't think I was racist, Dr. Hayes said quietly. I really didn't. I thought I was just being practical. Protecting hospital resources. Asking necessary questions. Margaret took his hand. Did you ask those questions of everyone? Or just certain people? He could not answer. Because he knew the truth. He had not asked everyone. He had made assumptions based on appearance. Based on bias he had not even realized he had. I've destroyed everything, he said. My career. My reputation. The hospital. Everything. Maybe, Margaret said carefully. This is an opportunity to learn. To grow. To become better. If you really didn't realize you had these biases, now you know. Now you can work on them. It's too late for that. It's never too late to become a better person. It might be too late to save your job, but it's not too late to change who you are. Dr. Hayes looked at his wife. She'd been married to him for 22 years. She knew him better than anyone. And she was telling him he could change. That he should change. That he needed to change. Maybe she was right. Maybe this disaster could become something else. Not a redemption story. He did not deserve redemption. But maybe a learning story. Maybe a cautionary tale that helped other people recognize their own biases before they hurt someone. It was not much, but it was something. A small purpose in the wreckage of his career. Across town, the two medical residents, David and Eric, met for dinner. They were both still thinking about what they had witnessed, about their own role in staying silent. We have to do better, David said. If we see something like that again, we have to speak up. No matter who the attending is, no matter what it costs us, Eric nodded. Agreed, I've been thinking about it all day. About all the times I've seen things that didn't feel right but said nothing. About how easy it is to just go along with the people in power. That has to stop. We're going to be attendings ourselves someday. We're going to have residents watching us, learning from us. What kind of example do we want to set? The kind that Dr. Richardson set today. Standing up for what's right, even when it's uncomfortable. Especially when it's uncomfortable. They clinked their water glasses together. A small toast to becoming better doctors. Better people. Better than what they had witnessed today. Change was coming to Metropolitan General Hospital. Big change. Painful change. Necessary change. It started with one woman's courage to stand up to discrimination, but it would continue with everyone who chose to learn from her example. Everyone who chose to be better tomorrow than they were today. The next morning, Dr. Richardson arrived at Metropolitan General Hospital at 7:30. She had dressed carefully. A professional dark suit, her credentials clearly displayed on a lanyard around her neck. This time there would be no confusion about who she was or why she was there. The receptionist from the day before saw her walk in. The young woman stood up immediately. Her face showed shame and regret. Dr. Richardson, I am so sorry about yesterday. I should have said something. I should have helped. Dr. Richardson stopped at the desk. Her expression was kind but firm. You're right. You should have. But I understand why you didn't. Fear is powerful. Fear of losing your job. Fear of making waves. Fear of going against authority. We're going to work on creating an environment where that fear doesn't stop people from doing the right thing. The receptionist nodded, tears forming in her eyes. Thank you for understanding. Understanding doesn't mean excusing. You have a responsibility to patients. We all do. Remember that going forward. Dr. Richardson walked toward the conference rooms. Staff members saw her and whispered. Some looked ashamed. Others looked curious. A few looked defiant, like they thought all this attention was overblown. Those were the ones Dr. Richardson knew she needed to reach most. The emergency board meeting was set for 8 o'clock. All board members had been called in. All department heads, the hospital's legal team, human resources. Everyone who had power or influence at Metropolitan General was going to be in that room. Dr. Morrison met her outside the conference room. He looked like he had not slept. Dark circles under his eyes. His tie was slightly crooked. In his arms he carried 3 thick folders. Everything you asked for, he said, handing her the folders. Patient complaints, staff reports, security footage summary, performance reviews, all of it. Dr. Richardson took the folders. She had already seen most of this. She had spent the evening reviewing documents Dr. Morrison had sent electronically, but having the physical copies made it real, made it undeniable. How many board members are here? She asked all of them. Everyone cleared their schedules. They know this is serious. Good. Let's begin. They entered the conference room. 12 people sat around a long table. The board president, Thomas Caldwell, sat at the head. He was a businessman in his 60s, successful and used to being in control. He did not look happy about the situation. Dr. Richardson took her seat. Not at the head of the table. That was still Thomas's position for a few more days. She sat in the middle where everyone could see her clearly. Thomas cleared his throat. Dr. Richardson, on behalf of the entire board, I want to apologize for what happened yesterday. It was unacceptable, inexcusable. We are deeply sorry. Thank you, Dr. Richardson said. But apologies are just words unless they lead to action. That's what we're here to discuss today. Action. Real, meaningful change. She opened the first folder. I've reviewed all the documentation Dr. Morrison provided. What I found is disturbing. Dr. Hayes had 17 formal complaints filed against him over 5 years. 17. Not one of them led to serious investigation or discipline. The board members shifted uncomfortably in their seats, Dr. Richardson continued. But that's not all. I also found complaints about 4 other physicians, 6 nurses, 3 administrative staff members, all showing similar patterns, all dismissed or minimized. What happened to me yesterday was not an isolated incident. It was part of a systemic problem. Now wait a minute, one board member interrupted. A man named George Patterson. You can't possibly be suggesting that our entire hospital is racist. That's a serious accusation. Dr. Richardson looked at him calmly. I'm not suggesting it. I'm stating it as a fact based on documented evidence. The question is not whether the problem exists. The question is what we're going to do about it. But 17 complaints over 5 years, another board member said. A woman named Susan Chen. How many total patients did Dr. Hayes see in that time? Thousands, probably. 17 complaints is a small percentage. How many complaints are acceptable? Dr. Richardson asked. 1? 5? 10? Where's the line? And more importantly, how many patients didn't complain? How many just left and never came back? How many told their families and friends to avoid this hospital? We don't have data on that. We only have data on the brave people who actually filed formal complaints. She pulled out several printed pages. I also did something else yesterday afternoon. I called 3 patient advocacy groups in our community. I asked them about Metropolitan General's reputation among minority patients. Do you know what they told me? No one answered. They told me that our hospital is known as a place to avoid if you're Black or Latino. They told me they regularly help patients find alternative facilities. They told me they've heard dozens of stories similar to mine. But most people don't file formal complaints. They just leave and never come back. Thomas Caldwell's face had gone pale. I had no idea. That's part of the problem, Dr. Richardson said. The people in power had no idea because they weren't listening. The complaints were there. The patterns were there. But no one with authority was paying attention. Dr. Morrison spoke up. Patricia, one of our senior nurses, told me yesterday that she filed 3 separate reports about concerning behavior. Each time she was told she was being too sensitive. Her concerns were dismissed. By whom? Dr. Richardson asked. By me, Dr. Morrison said quietly. I dismissed them. I defended Dr. Hayes. I prioritized his value to the hospital over patient safety and dignity. That failure is on me. The room went silent. No one had expected that admission. Dr. Morrison's honesty was uncomfortable but necessary. Dr. Richardson nodded. That's where we start. With honesty. With accountability. Dr. Morrison has taken the first step by acknowledging his role. Now the rest of us need to do the same. Every person in this room bears some responsibility for the culture that allowed this to happen. So what do you propose? Thomas asked. How do we fix it? Dr. Richardson stood up. She walked to the whiteboard at the front of the room. She picked up a marker. We fix it with a comprehensive plan. Not a quick fix. Not a single training session that everyone forgets in a week. A real sustained effort at cultural change. She began writing on the board as she talked. First, immediate actions. Dr. Hayes' employment is terminated effective immediately. Any staff member with multiple substantiated complaints faces immediate review and possible discipline or termination. We're not protecting anyone anymore. She wrote more. Second, mandatory implicit bias training for all staff. Not optional, not suggested, mandatory. From the janitors to the surgeons to the board members. Everyone. And not a one-time thing. Annual refresher courses, because bias work is ongoing work. More writing. Third, A complete overhaul of our complaint system. Right now it's too easy to dismiss complaints. Too easy to protect staff members at the expense of patients. We need a transparent system where complaints are taken seriously, investigated thoroughly, and where consequences are real. George Patterson raised his hand. Dr. Richardson, I appreciate your passion, but some of these measures sound expensive. We have a budget to consider, shareholders to answer to. Dr. Richardson turned to face him. Let me tell you what's expensive, George. Lawsuits, loss of state funding, damage to our reputation, patients going elsewhere for care. Do you know what happens to a hospital's bottom line when the state health commissioner publicly condemns it? Because that's what will happen if we don't address this properly. Are you threatening us? George asked. I'm stating facts. I have legal authority to investigate this hospital, to audit your practices, to recommend funding changes to the state legislature. I can do all of that whether I'm on your board or not. The question is whether we work together to fix this, or whether I have to force changes from the outside. Thomas held up his hands. No one is saying we won't work with you. We want to fix this. We need to fix this. Please continue with your plan. Dr. Richardson turned back to the board. Fourth, we establish a patient advocacy program. Dedicated staff whose only job is to help patients navigate the system. People they can go to with concerns. People who will listen and take action. People who report directly to the board, not to department heads who might have conflicts of interest. Fifth, we increase diversity at every level. In hiring and promotions. In leadership. A diverse staff is more likely to recognize and address bias, more likely to create an inclusive environment. Susan Chen raised her hand. I agree with all of this. But how do we measure success? How do we know if it's working? Excellent question, Dr. Richardson said. We establish clear metrics. Patient satisfaction scores broken down by demographics. Complaint rates. Staff diversity numbers. We track everything. We publish reports quarterly. We hold ourselves accountable to the community we serve. She wrote one final item on the board. And sixth, we create a zero-tolerance policy for discrimination, one that's actually enforced, not just words in a handbook. Real consequences for real behavior, from verbal warnings for minor incidents to immediate termination for major ones. Everyone knows the rules. Everyone follows them. No exceptions. Dr. Richardson set down the marker. This is just the beginning. The framework. The details will take months to develop. But this is what real change looks like. It's not easy. It's not quick. But it's necessary. Thomas looked at the board. All in favor of moving forward with Dr. Richardson's plan. Every hand went up. Even George Patterson's, though he looked unhappy about it. Unanimous, Thomas said. Dr. Richardson, you have our full support. Whatever resources you need. Whatever changes you want to make. You have the authority to do it. Thank you, Dr. Richardson said. But I need more than authority. I need commitment. From every person in this room, from every staff member in this hospital. This only works if we all decide that patient dignity matters more than our comfort, that doing the right thing matters more than protecting our egos. The meeting continued for another 2 hours. They discussed budget allocations, timeline for implementing changes, who would lead different initiatives. It was detailed work, important work, the foundation for everything that would come next. When the meeting finally ended, people left with clear assignments, clear expectations, clear understanding that excuses were over. Action was beginning. Dr. Morrison pulled Dr. Richardson aside. I want you to know something. Yesterday was the worst day of my professional life. Realizing how much I had failed, how much I had allowed, but today feels like the start of something important. Thank you for having the courage to push us, to demand better. You're welcome, Dr. Richardson said. But the real test comes now. When the cameras are gone. When public attention fades. That's when we find out if people are really committed to change or if this was just crisis management. I'm committed, Dr. Morrison said firmly. I promise you that. Dr. Richardson believed him. She had seen his genuine regret, his willingness to take responsibility, his desire to do better. Not everyone could change, but he seemed willing to try. Over the next few days, announcements went out to all staff. Dr. Hayes's termination was made public. The new policies were explained. Training sessions were scheduled. Some staff members embraced the changes. Others resisted. But slowly, surely, the culture began to shift. 3 patients who had previously filed complaints came forward with more details. Their stories were similar to Dr. Richardson's. Assumptions made, dignity denied, basic respect withheld. Each story was documented. Each one added to the evidence of systemic problems. The videos from the waiting room continued to spread online. Local news became national news. Metropolitan General was in the spotlight. But instead of hiding, Dr. Richardson made herself available. She did interviews. She talked about what happened and what was being done to prevent it from happening again. "This is not just our hospital's problem," she said in one interview. "This is healthcare's problem. This is America's problem. Bias exists everywhere. The question is whether we're brave enough to name it. Address it, fix it. Metropolitan General is choosing to be brave." The hospital received hundreds of emails, some supportive, some critical, some sharing similar experiences at other facilities. Each email was read. Each one was taken seriously. The work of change had truly begun, and through it all, Dr. Richardson remained focused on her goal. Not revenge, not punishment for its own sake, but real lasting change, the kind of change that would make sure no other patient ever felt what she felt in that waiting room, the kind of change that would transform not just one hospital, but inspire others to examine their own practices, to look in the mirror and ask hard questions, to choose courage over comfort. Because that's what leadership meant, not maintaining the status quo, but having the courage to demand better, to be better, to create systems that honored the dignity of every person who walked through the doors seeking help. That was the real reckoning. Not just for Dr. Hayes, not just for Metropolitan General, but for everyone who had ever stayed silent when they should have spoken up. Everyone who had ever looked away when they should have intervened. Everyone who had ever prioritized comfort over doing what was right. The reckoning had come, and nothing would ever be the same. 3 months had passed since that Tuesday morning in the waiting room. 3 months since Dr. Richardson had walked into Metropolitan General Hospital as a regular patient and walked out as a catalyst for change. The hospital looked the same from the outside. Same building, same parking lot, same signs. But inside, everything was different. Dr. Richardson stood in her new office. It was smaller than she expected for a board chair, but she had chosen it deliberately. She did not want the biggest office on the top floor. She wanted to be close to the patients, close to the staff, close to the real work of the hospital. From her window, she could see the main entrance. She watched people coming and going, patients arriving for appointments, families visiting loved ones, staff members starting their shifts. Each person represented a life, a story, a need for care and dignity. Her assistant knocked on the open door. "Dr. Richardson? The quarterly board meeting starts in 15 minutes. "Thank you, Maria. I'll be right there." Dr. Richardson picked up a thick folder from her desk. It contained reports from the last 3 months. Data, statistics, stories, evidence of change. Some of it was encouraging. Some of it showed how much work remained, but all of it was honest. She walked to the conference room. Board members were already gathering. Thomas Caldwell, Susan Chen, George Patterson, others, the same people who had sat in shocked silence 3 months ago. Now they looked different, more engaged, more aware, more committed. "Good morning, everyone," Dr. Richardson said as she took her seat at the head of the table. This was her place now, officially. "Thank you for being here. Today we're going to review our progress on the Equity and Inclusion Initiative, what's working, what's not, and what we need to do differently." She opened her folder. "Let's start with the bias training. As of today, 93% of staff have completed the mandatory training. The remaining 7% are scheduled to complete it by the end of the month. How has the training been received?" Susan asked. Dr. Richardson smiled slightly. Mixed reactions. Some staff members have embraced it. They've told us the training helped them recognize biases they didn't know they had. Others have resisted. They see it as unnecessary or accusatory. But resistance is part of the process. Change is uncomfortable. She turned to the next page. "We've also established the Patient Advocacy Program. We hired 5 full-time patient advocates. They're available 7 days a week. In 3 months, they've handled 247 cases. Some were simple issues like billing questions or appointment scheduling, but 32 cases involved serious concerns about patient treatment or staff behavior. 32 in 3 months. George Patterson looked concerned. That seems high. It's actually lower than I expected, Dr. Richardson said. These problems existed before. We just weren't capturing them. Now we are, and we're addressing them. That's progress. She clicked a remote. A presentation appeared on the screen at the front of the room. Here are our patient satisfaction scores broken down by demographics. Overall satisfaction has increased by 12% since we started these initiatives. But more importantly, look at the gap between different demographic groups. The graph showed clear trends. The satisfaction gap between white patients and patients of color had decreased. Not eliminated, but decreased. Progress. Black patients reported a 15% increase in satisfaction. Latino patients reported a 13% increase. Asian patients reported an 11% increase. These numbers tell us that our changes are making a real difference. Thomas Caldwell nodded approvingly. This is excellent work, Dr. Richardson. The board is impressed. Don't be too impressed yet, Dr. Richardson cautioned. We still have significant problems. We've terminated 3 staff members for discriminatory behavior in the last 3 months. We've disciplined 7 others. That tells us the culture change is still ongoing, still necessary. She advanced to the next slide. We've also made progress on diversity hiring. 23% of our new hires in the last quarter have been people of color. That's up from 14% in the previous quarter. We've promoted 5 people of color to leadership positions. We've created mentorship programs to support their success. Dr. Morrison raised his hand. He had been mostly quiet during the meeting. Dr. Richardson, I want to add something. I've been personally involved in hiring for my department. And I've noticed something interesting. When we focus on diversity, we don't just get more diverse candidates. We get better candidates overall. We're accessing talent pools we previously overlooked. Our department is stronger because of it. That's an important observation, Dr. Richardson said. Diversity isn't just about fairness, though that's critical. It's also about excellence. Different perspectives make us better at what we do. She closed the presentation, but numbers only tell part of the story. Let me share something else. Last week, I spent a full day in the emergency room. I watched how patients were treated, how staff interacted with each other, how the new policies were being implemented in real time. The room went quiet. Everyone wanted to hear what she had observed. I saw a Latino man come in with chest pain. He spoke limited English. In the past, based on our complaint records, he might have been dismissed or given minimal attention. But I watched a nurse spend extra time with him. Use a translation app to communicate. Treat him with patience and respect. He received excellent care. That nurse told me the bias training helped her understand the importance of those extra moments. Of that extra effort, Dr. Richardson's voice grew softer. I also saw an elderly black woman arrive for a cardiology appointment. She looked nervous, uncertain, like she wasn't sure she belonged there. The receptionist greeted her warmly, made her feel welcome, helped her with paperwork. That receptionist was the same young woman who checked me in 3 months ago, who watched Dr. Hayes treat me with disrespect, who stayed silent. She's not staying silent anymore. Several board members had tears in their eyes. Those moments, Dr. Richardson continued, don't show up in statistics, but they matter. They're the real measure of whether we're changing, not just our policies, but our hearts. She pulled out one more document. However, I also need to share something difficult. We received a lawsuit last week. From Dr. Hayes, he's claiming wrongful termination, saying he was treated unfairly, that his reputation was destroyed without due process. George Patterson groaned. I knew this was coming. What's our liability? The hospital's lawyer, who had been sitting quietly in the corner, spoke up. Minimal. We have extensive documentation of policy violations, multiple complaints, video evidence. His case is weak, but it will be expensive to defend, and it will bring negative publicity. Let it come, Dr. Richardson said firmly. We did the right thing. We followed proper procedures. We protected our patients. If Dr. Hayes wants to fight that in court, we'll defend our decision. But we will not back down from doing what was right. Thomas looked concerned. What about settlement? Could we make this go away quietly? We could, Dr. Richardson said. But we won't. Settling sends the wrong message. It suggests we're not confident in our decision, that we're afraid of scrutiny. We're not afraid. We did the right thing for the right reasons. Let a jury hear the facts. Let them decide. The room fell silent for a moment. Then Susan Chen spoke. Dr. Richardson, I want to say something. When you first walked into that board meeting 3 months ago, I'll be honest, I was worried. I thought you were going to tear this hospital apart. Destroy everything we had built, she paused. I was wrong. You haven't destroyed anything. You've made us better. You've made us face uncomfortable truths. You've pushed us to be the hospital we always claimed to be. On behalf of this board, thank you. Other board members nodded. Even George Patterson, who had resisted many of the changes, looked moved. Thank you, Dr. Richardson said. But this isn't my achievement alone. It's everyone's. Every staff member who took the training seriously. Every patient advocate who listened to concerns. Every doctor who examined their own biases. Every nurse who spoke up when they saw something wrong. This is a collective transformation. She stood up. But our work is not done. Not even close. In the next quarter, we're expanding our efforts. We're creating a community outreach program. We're going to partner with local organizations to build trust with communities who have historically avoided this hospital. We're going to bring healthcare to people who need it most. We're also developing a research program. We're going to study health disparities in our region, collect data, publish findings, share what we learn with other hospitals. Metropolitan General is going to become a leader in healthcare equity, not just for ourselves, but as an example for others. Thomas Caldwell smiled. You're ambitious, Dr. Richardson, but I think that's exactly what we need. The meeting continued for another hour. They discussed budgets and timelines. They reviewed specific cases and learned from them. They planned for the future. It was detailed work, sometimes tedious work, but important work. When the meeting ended, Dr. Richardson walked back to her office. She had another meeting in 30 minutes, then 3 more after that. Her calendar was always full now. The work of transformation was constant, but as she walked through the hospital hallways, she noticed small changes everywhere. A receptionist greeting a patient warmly in Spanish. A doctor taking time to explain a diagnosis in simple language. A nurse advocating for a patient who looked uncertain. These moments were everywhere once you started looking for them. She passed the waiting room where it all began, where Dr. Hayes had made his assumptions, where she had maintained her composure while being publicly disrespected. The room looked the same, but it felt different. The energy was different, more welcoming, more inclusive. Patricia, the senior nurse, saw her and walked over. Dr. Richardson, do you have a moment? Of course, Patricia handed her a letter. This came today. I thought you should see it. Dr. Richardson opened the letter. It was from a patient, a black woman in her 40s. She wrote about her experience at the hospital last week. How nervous she had been to come. How previous experiences at other hospitals had left her feeling unwelcome. But how Metropolitan General had treated her with respect and dignity. How the staff had listened to her concerns. How she finally felt like her health mattered. This is why we do this work, Dr. Richardson said softly. This right here. Patricia nodded. We get letters like this now. Not every day, but regularly. People are noticing the changes. People are coming back. People are telling their friends and family that it's different here now. That's good to hear, but we can't become complacent. The moment we think we've arrived is the moment we start sliding backward. This has to be ongoing, always. I know, Patricia said, and I promise you I'll keep speaking up. I'll never stay silent again. You taught me that, Dr. Richardson smiled. I didn't teach you that. You already knew it. I just reminded you of your own courage. That evening, Dr. Richardson sat in her car before driving home. She was tired. This work was exhausting, but it was also fulfilling in a way nothing else had ever been. She had spent 40 years in healthcare. She had performed surgeries, published research, advised government officials, but this felt like her most important work. She thought about Dr. Hayes. She had heard through colleagues that he was in therapy, working on understanding his biases, reading books about racism and healthcare, attending workshops. Maybe he would truly change. Maybe he would become an advocate for equity. Or maybe he would just fade away. Either way, his story served as a warning, a lesson about what happens when bias goes unexamined. She thought about the 2 young residents who had witnessed that day, David and Eric. She had met with them last week. They told her how that experience had changed them, how they were more aware now, more willing to speak up, how they wanted to be different kinds of doctors, better doctors. She believed them. She thought about all the patients who would benefit from these changes, not just at Metropolitan General, But at other hospitals that were watching, learning, implementing similar programs, one incident had sparked a movement. Not because she was special, but because she had been willing to use her power and position to demand better. Her phone buzzed. A text from James. "Dinner's ready." "Come home," she smiled and started the car. Home, to her husband, to rest, to recharge for tomorrow. Because tomorrow there would be more work, more challenges, more opportunities to make a difference, but that was okay. That was the nature of real change. It wasn't one dramatic moment. It was thousands of small moments, thousands of decisions, thousands of people choosing to do better, choosing to be better. Metropolitan General Hospital had a long way to go, but they were on the right path. Not perfect, but better. Not finished, but progressing. And that was what mattered. As Dr. Richardson drove home through the evening traffic, she thought about that Tuesday morning 3 months ago. How painful it had been, how frustrating, how dehumanizing, but also how necessary, because sometimes you have to break something completely before you can rebuild it properly. Metropolitan General had been broken in ways no one wanted to admit. But they were rebuilding now, stronger, better, more just, not because it was easy, but because it was right, and in the end that was all that mattered. Doing what was right, even when it was hard, especially when it was hard, because that was the only way to create lasting change, change that honored the dignity of every person who walked through those doors seeking help, change that transformed not just a hospital, but the people within it, the community around it, and hopefully the healthcare system beyond it. That was the power of one person's courage, one person's decision to stand up, one person's willingness to use their position to demand better. Dr. Diane Richardson had walked into that hospital as a patient seeking care. She had left as a catalyst for transformation, and 3 months later, that transformation was well underway. Not finished, never finished, but happening, really happening, and that made everything worthwhile. Every difficult conversation, every uncomfortable meeting, every hour of work. All of it was worth it to create a place where every patient received care with dignity, where every person was treated with respect, where bias was confronted instead of ignored. That was the true transformation. Not just policies and procedures, but hearts and minds, one person at a time, one interaction at a time, one choice at a time. And it all started with one woman who refused to accept disrespect, who maintained her composure in the face of discrimination, who used her power not for revenge but for justice, not for punishment but for progress. That was leadership. That was courage. That was how you changed the world, not all at once, but step by step, day by day, person by person, and the change was beautiful to see.